So, good morning, Flawless family. We are honored to be joined by Todd Weatherly, a dedicated therapeutic consultant and mental health advocate with over 30 years of experience in this field. As president of Stucker Smith and Weatherly, Todd has helped countless families, schools, and programs navigate behavioral health with care and clarity. Todd also hosts the Head Inside Mental Health podcast from Asheville, where he shares real conversations around healing and recovery. His work deeply aligns with what we're doing over here at Flawless, which is supporting people with dignity and creating spaces for meaningful connections. So, thank you for joining us here today, Todd.
Glad to be here. Thanks, Trey.
And as we always start things off here, we like to ask, how are you really doing here today, Todd?
How am I doing?
Yes, how are you
Uh,
doing?
I'm pretty good, I would say that we are not immune to all the influences of the world, even the daily strifes of life. We recently had a washing machine flood my home, so
Oh
my
man,
what you see at my office is the part that was not flooded, and the other part it will
sorry to
have
hear
to be
that.
carpeted, and so we're getting all this work done, and it's kind of a pain, but it's that's those are the things in life that happen. So, but otherwise, I'm doing pretty good. Thank you for asking.
Yeah, of course. Again, sorry you're kind of going through that struggle, but glad you're here with
We
us.
all go through struggles, right?
Exactly right. And you're someone that knows that all too well. So, as I mentioned, you've had a long and impactful career in behavioral health. So, what originally started this journey, for you to kind of pursue this industry, and what's kept you here all these years?
Um, Technically speaking, what started me on this journey was the had a couple of pretty good teachers in high school, and one of them decided to offer a psychology class.
Hmm.
I like I guess it was junior year in high school. So, and I was, I was very interested in philosophy and those kinds of things, and had kind of a questioning mind. And the philosophy is the grandfather of psychology, of course.
Hmm.
So, at any rate, the I took psychology and ended up, going to undergraduate and get my undergrad in psychology, and just had my I have a deep and intense interest, passion for human behavior and how human behavior kind of works itself out in the world, and how people kind of go through making decision making and what causes them to get off. I love asking big why, what are the big questions, and how do those advise us to live everyday life. And so that really was what started a full career. And then right out of college, I took my first job with a wilderness adjudicated youth wilderness based program as a counselor. So I saw kids with severe trauma coming from inner city environments, drug use, theft, parents, vacating and deserting, kids whose mom was addicted to drugs and had their kids go out get drugs for them so they could bring them back. Those kids. And they taught me a lot. They one teach you that you better do your own work before you get involved in doing this work, because whoever you're working with is going to see it if you don't. So,
And I mean, 30 years in any industry is impressive, but as you mentioned, like this is an industry that can wear you out, that you have to take on a lot of, trauma and stress from other individuals that you're dealing with. How do you stay grounded and, stay efficient when doing all this emotional work and avoid burnout?
um, I would say, your statement about, how do you do this work, taking on all this it's like, well, first of all, you don't take it on,
Mm,
and you've got to learn how not to take it on. It's not yours to take on. And the way that I am best at my job when I'm objective, when I
hmm.
can see what's happening clearly, help families make decisions, sound decisions. And they are very emotional, and they are they're in urgent situations, and a crisis has occurred, and they don't know what to do with this family member who's struggling and suffering from a severe, persistent mental illness, possibly substance use thrown in there as well. And they're trying to make decisions on the fly, that they are not experienced enough, and as we know, the world is not very it's not very user friendly. if you're faced with that kind of challenge. So, what I have to be careful to do, and a good example is if you've got a family they've been dealing with a family member who maybe they've gotten into the hospital, or maybe they're in the midst of a crisis, but they're not quite hospitalizable yet.
Hmm.
And the family is in crisis. But the truth is they're not in crisis yet. This person that maybe they're in the home and they're having symptoms and everything else, they're not committable, so it's hard to take any real action as of yet. But the family has been paying for all their groceries and paying for the phone and letting them pay for a place to stay. And the work comes, it's like you're not actually in crisis, though it feels that way, and I understand that it feels that way. But the truth is, what you've got to do now is start setting progressive limits with this individual so that they understand that your support is tied to them getting care, the necessary care that they need. Because, obviously, for a person who's suffering, a lot of our clients suffering from thought disorder or psychosis or schizophrenia or schizoaffective disorder, insight is not their key strength.
Hmm.
They are often not insightful about their condition. Anosognosia is a term that gets thrown around, not being aware that I'm not sick, I don't need help, you know. Um, well, there's even a book. It's right back here, written with that very title. And so, letting people know it's like, look, first of all, this is hard, but what I want you to do is level down your limbic system.
Hmm.
You've got to try to stay measured and controlled because they're gonna talk like you're killing them because you've taken away their phone or are not going to pay for them to have some allowance anymore, whatever it is. You're going to have to set these limits, and they're going to have to realize that this is serious and that their health is the primary focus for everyone who's trying to help them. And what you need them to do is get the care that the professionals are saying that they need.
Hmm.
And if you want to use me as the bad guy, if you want to, say that we've got a person advising us, so that it feels like, your decision making or what you're communicating to that person has this level of authority to it, then great, use it. Do whatever you've got to do. So not taking on their anxiety and their feelings that it is, this crisis situation, we have to do something right now. It's like, well, no, hold on.
Hmm.
What we're going to do is going to take time, and we need to all slow down, and and if you can do that, it's going to work out a lot better. If we take this as a measured approach, it's a marathon, not a sprint. We like to say all the
Right.
time, and I'm here to make sure I'm here to lend that level of objectivity and that level of even mindedness to the family while they're in crisis.
Which, and I kind of love the way you kind of phrase it and broke down that understanding, but at the same time, right, that's a difficult situation when you're helping out a loved one for neurotypical individuals, right? So you mentioned that individuals in this situation are also battling their own mental health challenges. How do you avoid a circumstance where it's like, oh, so your love is conditional? Like, what do you mean? Right? So you use the phrasing like progressive limits, right? But how do you make sure to avoid an individual feeling like, oh, I thought you guys loved me and now I have to do X, Y, Z, right? I feel like that's a situation you might find yourself in as a caretaker, as a love person. How would you advise them on navigating through that?
Uh, you know, I would say that first of all, for a family, there's two thoughts come to mind to me when you say that. One, many parents get in this position where they don't want their loved one to feel uncomfortable, right?
Mhm.
They don't want to put them through discomfort. It's like, well, discomfort is could come in a lot of different ways, and harm can come in a lot of different ways. What I can tell you, if this person persists in not caring for their condition and not finding the right medications or the right treatment protocol or whatever it is, and they continue to experience delusional thoughts and psychotic episodes and everything else, the longer they keep doing that, the worse their condition gets. The more often they have psychotic breaks, it's like setting the brain on fire.
Mm.
It's very damaging to a person, and people who go through long-term, long decade-long kind of stints of poor care and poor med management and those kinds of things, they'll end up with even cognitive damage issues. as a
Mm,
result, because psychosis is terrible for the brain. And so some of the medications they have side effects, they have things that you want to be aware of, and there are all kinds of health concerns that you want to be aware of and manage for a person who's suffering from serious and persistent mental illness and needs to take medications. However, not treating the condition is far more damaging than treating it.
mm,
And so your goal is not just this moment. My goal, and just like anything that is anybody who's had a severe health condition of any kind realizes that treating it and managing it and dealing with it involves some level of discomfort and change in lifestyle and everything else. If you're suddenly diagnosed with diabetes, it's like, well, got to change my diet, got to visit the doc. I might have to take these shots. I have to stay on top of my health. And I wasn't used to doing that, but all of a sudden I'm faced with this thing that I have to manage, and it's uncomfortable, and it causes you have to change. Otherwise, the condition gets worse. Mental illness is no different. It
mm,
requires a person to shift and change. And for parents, it's like your goal is a longer term goal. You're not just trying to satisfy their immediate comfort right now. And that's the thing I like for parents to just stay mindful of while they're setting these limits. That goal is much greater than just an immediate discomfort you might feel they are having. Moms have a hard time with this; they always
mhm,
do. But it's like, look, mom, you don't want your baby to get sicker, and
mhm.
that's what's going to happen if we don't do this work now.
And sometimes I love you looks like no, it looks like
Right. I
saying
love you
no.
looks like no. And
Right.
the kid's going to say this. They're going to use every tactic that they've got in their arsenal. It's like you don't love me and you guys have always been terrible to me, and I mean it is routine that a person suffering from delusional thought um kinds of kinds of conditions will turn on their parents. They're
Hmm.
evil and they've done terrible things to me even though they haven't. And or, you don't love me and you don't care for me and I just want to take care of myself. It's like, yeah, but you got no money and you got no job and you got no resources other than what your parents provide for you. So, and I've had this conversation with the client, with the person who's suffering from the condition and they're talking to me. It's like, well, I just want to do what I want to do. It's like you can, so long as you can provide for yourself. And until you can do that, you are beholden to the people who support you. So I would consider following their direction until you can get and going through this process until you can get to a place where you can get on your own feet and make your own decisions and do the things that you want to do for your own life. But that doesn't just turn on a dime. You got to start in one. There's some distance between these 2 points, where you are now and where you want to be. There's some stuff you're going to need to do. It doesn't just happen because you say, "Hey, I want it to happen." You throw a temper tantrum. That's not how that works. The world doesn't care about your temper tantrum.
Very, very very, very true, right? And this expertise that you have, right? And I appreciate that advice. That's helped you to lead into the position of taking over your consulting practice that, and shameless plug here, was founded by Virgil Stucker. So he's someone that, I had the pleasure of having a conversation just like this. So I'll make sure everyone watching, make sure you check our YouTube channel, check out that conversation. It's about 30 minutes long. It's a great one. But for you, Todd, I want to ask, what lessons have you learned from Virgil and what has it meant to continue to not only build on the progress made to this point, but also shape your own vision and as you kind of take the front with this consulting practice?
Well, I talk to Virgil regularly, um, and he has been a friend and mentor of mine now for over a decade. I think 15 years now. And so, you know, one of the very early things that Virgil oriented me to was when people would say, well, maybe we're not the people who can help. They need to go somewhere else. And Virgil would be like, where else are they going to go?
Mm,
We're the people who can help. And really just, he was a person who's very adamant that you didn't give up on people and you didn't give up hope.
hmm
And that obviously, and I say it quickly and I don't think about it anymore. And when I hear it out in the world, it startles me a little bit, but I never refer to a person as their condition, that schizophrenic over there or that this person who suffers from a mental health condition, in this case, schizophrenia. And I have a client who suffers from schizophrenia and psychotic features to his condition, say, for example. And for a person who doesn't do this work, that may sound like a lot to say.
Hmm.
It it doesn't even occur to me anymore. It doesn't even it wouldn't occur to me to even say it differently. And Virgil's responsible for that. Um, because I think you get into the field in certain areas and you refer to people as their condition. That is a mistake that this field routinely makes. But it's not just wording; it's the whole idea of what care should look like. That there's an entire philosophical ideology behind that expression. Is that this is a person. This person has hopes and dreams. They are capable of finding their way to recovery and fulfilling those hopes and dreams. They may be a person who suffers from a condition, but they are also a person who can recover from that condition, who can learn how to manage that condition, who could then lead a life of fulfillment and satisfaction as a result of learning how to recover and manage their condition. All of that lives in speaking about people who suffer from severe mental health conditions that way. And that is something that Virgil was adamant. For me and everybody who was a staff member back in the day in Cooper East, he was adamant that we all saw the people that we served and their families and the work that we did in that way, with that umbrella covering all the work that we did. So everything that we did was about accepting people, hearing them, understanding them, and treating them as people. And I think Cooper East kind of did a good job, and I would say Gould Farms in there as well. Of if you walk on campus, you're going to have a hard time picking out the staff from the residents.
Wow. Yeah. I mean, you're kind of showcasing that even in this industry with people that are dedicated to improving the lives of the people they serve, there's still at times is a required paradigm shift to, understand people and continue to humanize them and to correct some of the mistakes that have been made. So I'm curious is how much of that, right? I guess my first question is, we talked about therapeutic consulting, versus clinical treatment. How much of that is, a product of therapeutic consulting being different from clinical treatment? And is the difference if you're looking at the two, like your guys' philosophy versus traditional treatment?
There's a lot of gauges in there, and a lot of that's as a result of insurance coverage, people's ability to pay for private pay kind of care, and out of pocket expenses and treatment periods and all these other factors. Ideally, I would love to see every program out there deliver their programming with some version of that ideology.
Mhm.
That does not always happen. That does not necessarily make them bad places. It does not necessarily mean that a person who goes get care at one of these places is not going to be successful in their recovery. So you've got to gauge that a lot. But my job as a consultant, having been through the experiences that I've been through, under Virgil's tutelage for a long time, and then going and taking that to other executive director and CEO roles as I, proceeded in my career, the as a consultant, I can bear witness. I can look at a program in literally minutes and make a determination as to whether or not how close to that kind of script and or a script or ideology like it are they following, and are they going to be a good program for this client. And if I've got 10 ideal boxes I would like to check off if I'm going to place a person in a program who's needing care. If I can get 7 of those boxes checked off, I feel like I'm doing a pretty good job. It's rare you get all 10.
Mhm.
And getting all 10 may mean you're going to get 5 of them out of this program and another 5 out of the program they go to after that. So I need to get the really important ones in for the first step and make sure that we grab the others as we move on to the next step. So my job is to make sure that we are lining up on some level with what I feel to be is an ideal, and my job is to hold that ideal. And one, families get to know an ideal exists and has been achieved. That
Mhm.
there are programs out there. We know how to do good treatment in the world. Actually, we do. A lot of times it's just whether or not you can afford to pay for it. So
Mhm.
we know how to go. No, we know that good treatment exists, and families need to be aware that good treatment exists. And for programs, it's like this is the standard I hold. If you can't rise to it right now, I want you to at least be aware of it, that there is a standard, and I'm watching to see whether or not you meet it or are trying to meet it. And programs, knowing that they're being watched by someone like me, tend to be on their toes and they provide better care to the families that we serve. That's unfortunate, I think, in the world. I wish everybody was just like, we're doing the best of the best, but that's not what happens. I think a lot of times it's because, like, for the example, hospitals and, associated care providers around the circle of hospitals, they really don't know about good residential care. They don't know about other resources and things like that. And we know that it's bad. A lot of it's really bad. Um, and I think that it's bad because they don't know any better, because they've never seen anything else.
Mhm.
And if I can work to make them aware that a different model is available and out there, then we can kind of, the rising tide lifts all boats kind of idea. Maybe we can raise the tide a bit.
And I mean, it's so important that the services you offer are available. One from a patient standpoint, from a family standpoint, and also what you're doing, as you mentioned, to kind of have that accountability and watchful eye over programs that could take that next step and that next leap. But you mentioned something important that a lot of times things come down to insurance or the ability to afford it. So, as a consultant, or if the family approached you and wanted some advice or leeway or guidance but could not financially afford it, wasn't in a position to, what resources or what advice would you offer someone in that type of predicament?
Well, I'd say that there are a lot of grades to that.
Mhm.
As in, there are people who've got no insurance and no resources and no anything.
Mhm.
And they end up having to stand in line for community mental health services, community treatment services, which are not great. And over and maxed out. They're understaffed and they're overfilled and they've got long waiting lists and everything else. And my primary job for the people that we serve and any family that I work with is to be an advocate. Get
Mhm.
in there, talk about what you need, ask for a discount, tell the billing office to cut you a deal and give you 90 days to pay the thing off and all these things. And I would say that if and when we get families who are in those kinds of positions, maybe they've got insurance, it's not great insurance, and they don't have a lot of out-of-pocket resources, or they've got a little bit of resource and they've got fairly decent insurance. So, there are these grades that you hit. We cut discounts for families that we serve all the time. Always ask for a discount. If you find a level of care that you think you might, ask for it for free. I mean, after a long period of time of being in the field, you kind of collect favors. And I had a person who I had been working with for many years in professional capacity, and then they had a personal matter. They had a family member who was suffering pretty from severe and persistent mental illness and the all the associated symptoms thereof. And I called a private pay center and I said, look, basically, I've been working with you guys for a long time. I don't know how much, if you took all the families that I've referred to you, I don't know how much money in terms of revenue I'm basically responsible for your agency, but I know that it's really high and it's several million dollars. So I want you to give this person treatment for free. And
Wow.
they did.
Impact talks. So it sounds like.
Impact talks. It's like, then they did. And they gave this person who couldn't afford it otherwise, they gave it to him for free. If I was going to give any family any, do not accept no, do not get shut down, follow through,
Mm.
advocate for yourself, find other people who can advocate for you. the biggest thing is that you end up having to take on the job of being your own advocate if you can't afford resources like, a consultant or what have you. But um, I think that so many families get told something by a doctor out of the hospital or get told something by a private psychiatrist or a private therapist. And unfortunately, what they've been told is not true.
Mm.
You know, there is hope. There is a way to treat this condition. This doesn't mean that they're going to be this way and on medications for the rest of their life. Maybe they'll be on medications, but it doesn't mean they'd have to never live a life, never have a family, never have a life, never have a job or a community or people that they love. There's no, they get given these hopeless messages or no message. And it's like, well, they're too acute. I can't serve them anymore. The horror stories I hear coming out of the private practice world they're pretty bad.
Imagine.
Um, and so I just like, as you would with any information that you receive, get a second opinion, talk to people who've been through it before, find resources online, go to the Flawless Foundation and ask them for something. It's like, do you guys know somebody? What have you done in this case? Like, don't stop. Don't give up hope. There I You can get through it. I've seen people who couldn't afford a thing, not one dime. And one of them is the executive director of a recovery center that serves the kind of homeless population. They're a peer support spirit center. They're a valuable resource in our community. Their executive director, I interviewed her on our show. Their executive director's recovery story is nothing short of a miracle. But she didn't give up. That was the thing. She went through hard times, homelessness, I mean, the
Mm.
whole 9 yards, and came out the other side with her recovery intact and is now the executive director of a nonprofit agency. I mean, that's a success story right there. She didn't give up. And I tell people, don't give up. Advocate for yourself. Ask.
So much of what I'm hearing from the start of this, interview to now is being resourceful and thinking outside of the box. Conveniently enough, right now we are in the midst of National Therapeutic Recreation Week, which I think in my head is just another outside the box way of approaching, therapy. So as we celebrate, how recreation supports healing and wellness, how have you seen therapeutic recreation, especially in terms of outdoor activities? Benefit participants within your program? And then additionally to that, can you talk to more about the benefits of outdoor environments in general as it supports mental health?
Well, and I told you the first job out of college was, outdoor based program. Um, we were adolescents and we were in the woods year round. These were base camp environments, and we did some experiential tripping. And then my master's degree is in outdoor education. I could have taken two tracks. I could either have taken the therapeutic track or the recreation track.
Mhm.
I chose the therapeutic track. And I'm a big advocate for. We could spend an entire another interview on what the outdoors can do for people and how it is impactful. I'd say that primarily there are a couple of things that I say about experiential work, the therapeutic use of experience, and the therapeutic use of the outdoors and wilderness experiences and trips and things like that. There are a couple of things that I like to say that to me are kind of stand at the top. One is you want people who know how to do their job well. Obviously, you wouldn't go to a therapist that wasn't licensed and didn't know how to do their job and or wasn't very good at their job, ideally. And so anybody who's out in the outdoor world, who's doing their work in the outdoor world, you want that person to be competent and trained and all those kinds of things. But your medium, the outdoors, is incorruptible.
Mhm.
Hot is always hot. Doing activities at height like rock climbing, gravity is always gravity. Cold is always cold. Dark is always dark. Hungry is always hungry. It is not going to negotiate with you. It is incredibly clear. It does not care about your feelings about it. And it is an impactful way for a person to process a lot of different things that go on for them. It's like, I'm hungry. I need to get food. I'm hungry and I feel upset. I'm hungry. I want to throw a temper tantrum and I'm hungry and it's dark and I feel hopeless and everything else. But the solution is I'm hungry. I go to get food.
Mhm.
it's dark, I go to find light. You know, I'm scared. I get off of this cliff, whatever it is, and it will not negotiate with you as you go through your emotional response, and so you've got this medium that is that's like a rock in a river. It just doesn't move, and that is reliable, and it is comforting, and it is educational and informative. The other thing is that it also becomes a nonverbal way. You know, there's a lot of verbal processing, and verbal processing about emotional conditions is valuable and it has its limits. It needs to be coupled, especially for somebody who's got something that is a significant, clinically significant condition. It has to be coupled with strategies that are nonverbal, you know,
Mhm.
art, recreation, um, there are a lot of methodologies, you know, EMDR and Santrays and other kinds of and neurofeedback, other kinds of non-medication, non-verbal strategies for dealing with trauma and emotions and anxiety and emotional regulation. There are a lot of them out there, and you should work to go find those, even if you don't suffer from a major mental health condition. Like these are all these things. Going out for a walk, it's one of the healthiest. It's better than antidepressants.
100%.
And, you know, you you spend as much energy laughing as you do running,
Wow.
and it's like that kind of thing really helps regulate a person's emotional system. And it's you don't need medications for it. You don't have to pay for it. You can go outside to the park. Being outside, just being in nature and that sort of thing, we know has a definitive and measurable impact on the brain. Brings it out of alpha state and closer to theta state, which is this, you know, or beta state, excuse me. Beta state's like driving in 5 o'clock traffic. Down to alpha and theta is more like sitting and watching TV. Going outside and being in nature and seeing off in the distance and looking at a sunset, it has a very measurable impact on the brain and brings you into calmer states. I remember when my kids were young and they'd be throwing a temper tantrum. I'm like, we're going outside. And we just go outside and the whole thing would just change, you know?
Oh, I
So
mean, as a young dad, I'm putting that in the back of my mind for sure.
use it. We're
We'll talk.
running around the house. We're just going to run around the
Yeah.
house.
You're certainly a wealth of knowledge. I have two more questions for you, but the first one, I want to make sure that we give opportunity. What is the Head Inside Mental Health podcast? And if you just want to introduce that a little bit, what can people find when they check out your podcast?
Well, I'll tell you that I started it about 3 years ago, and it's I use it as a way to talk to professionals in the world that are kind of, you know, on the forefront, conversations about mental health and substance use with experts and advocates and professionals from around the country to
Hmm.
talk about, you know, the world of behavioral health care. What's going on out there? Like, how do we do this, and how do we make this better, and what's the newest treatment modality that's really working these days, and just bringing all that to the forefront for so that people can really see it, and hear about it and know that it exists. It's just kind of I mean, I talk to doctors and psychiatrists and doctorate level therapists and people from across the country, even from, you know, bordering countries, and the wealth of information that's there and then we get to talk about is cool. I mean, I get to nerd out for, you know, 30 or 40 minutes, but these people really know what they're talking about, and they've all got 20, 30, 40 years in the field. So when you can listen to that kind of expertise for free, it's a great resource.
Yeah, it's great
Just like
education.
you guys, just like Flawless Foundation is.
Yeah. So I've always said I feel like I'm getting like my PhD working at Falls because I get to have conversations like this where I'm just getting, inundated with knowledge. So I appreciate you for that. Now my last question for you here today, Todd, is we have this concept of a flawless world. So your pictured ideal society. I want to know what a flawless world looks like for you and what's giving you hope that we're moving closer towards that world.
Mm. um, well, you know, to me, um, there's beauty in flaw.
Mm, hmm.
You know, without struggle and strife and without, you know, having to overcome the flaws that we have. Uh, those are the things that make people into these great and wonderful, special kinds of folks that are in the world. So I'm not. It's not that I'm trying to get rid of flawlessness or get rid of flaws per se. I have them myself. My wife tells me I do. Um, but that we have a place that there are places where people can work those things out.
Hmm.
That if you suffer from mental illness, there are plenty of people out there that are they've got it historically in their family. They get all of a sudden everything was going great, and they turn 19 or 20, and they've gone to college, and they end up with a psychotic episode and find that they're bipolar. Like their life was sounded great up until then, and then genetically their brain was inclined, and they ended up falling into that world all of a sudden. So now they've got something to deal with. And a lot of times that person, for example, doesn't know where to turn, has never heard anybody talk about mental health and that it's normal and that other people have it and that you don't have to feel ashamed and that it's okay to get help. And we have this society where we're still fighting with, the ideology around mental health, um, and how people are accepting of it, you know. And so I would like to see a world where that person knew immediately that there were places for them to get help and they didn't have to feel alone and that there was a way for them to get through it and continue living this life that they have plans and goals for. Because I think the thing that hurts us most is that that person feels isolated. And then they get sick and they get worse, and maybe they don't know who to turn to. And eventually, the parents are like, "Oh crap, something's happened." They don't know who to turn to, and the community doesn't want to talk about it. I mean, people lose friends because they're like, "Oh, that person's, they got serious struggles," and then all of a sudden they've lost community as a result. We're not very compassionate. A flawless world, in my opinion, is a compassionate world, where people who need help feel like they don't have to be ashamed to seek it, and that help is accessible in a way that they can get it immediately at the time when they have their greatest need. So that's the world I'd like to see. The emergence of these programs and emergence of, you see a lot more treatment programs out there these days. You see a lot more communication about dealing with mental health and mental wellness out in the world. You know, resiliency is a big topic on the mind of school systems. You're seeing resilience programs that are going on out there. We're a lot more aware now, and from diagnostic profiles, then people think that the occurrence of people on the neurodiversity spectrum, right, neuroatypical, that
Hmm.
there's more people who are neuroatypical these days. That's not actually true. The truth is that we have become a lot more sophisticated in testing it, and people are a lot more willing to go and get tested. So we're seeing a lot more of these cases because people are coming out and they're being honest about these conditions and they're not afraid to say so. And I think that's where I see that world starting to emerge. We're getting a little bit closer. Nothing happens all at once, but we're getting a little bit closer. And places like Flawless Foundation, going out and spreading the good word. That's what we need more of, man.
Yeah, I mean, Todd, I that's a perfect answer, a flawless answer, if you will. So, I definitely appreciate, the information you've shared. I feel like I'm a better advocate and educator because of this conversation. So I definitely want to plug some of your resources to make sure that others that feel the same way have an opportunity to meet with you. So, what we're gonna do is make sure in our description, our YouTube description, we have, Tucker Smith and Weatherly links as well as links to your podcast, Head Inside Mental Health. Is there anything you want to leave the audience with as we send off here today, Todd?
Don't be afraid to call me, call someone else. You're struggling with these things. Make sure you get the help that you need because you deserve it and it is there for you.
Awesome. Todd, I appreciate your time and your education. I hope you have a flawless rest of your day. Of
Trey, it's great to meet you. Thanks for having me on the show.
course. See ya.
Bye now.